Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board-certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for y'all today? I know y'all hear me talk about how plastic surgeons are magicians, and they really are magicians, and they're changing people's lives every day. And it's much more than liposuction and tummy tucks. There's a lot of other procedures that plastic surgeons do that you guys probably haven't heard of. And today I'm so excited to share Alex's story. And we have Alex's surgeon with us, Dr. Megan, joining us again. Hello, guys.
Hi.
Alex, This is your first time on a podcast?
Yeah, I have never been on a podcast. I've listened to a lot of them, but I've never actually been on one.
It's so much fun. Just pretend it's me, Dr. Megan, you, and your best friend. Our listeners are, I call them my girls. My listeners are a part of our family. And what I know they love the most is hearing other people's journeys. And I'm so excited to have this platform and be able to share all types of journeys and all types of surgeries and all types of procedures. And today's procedure is top surgery. So Dr. Megan is going to walk us through what top surgery is medically. And then Alex is going to tell us what top surgery was for him. Dr. Megan?
Yeah. So I will take it away. So, technically when we talk about top surgery, we are talking about a gender affirming surgery of the chest. So technically that could be, more creating breasts or creating a more masculine chest. But I think more in the language that we're using more and more nowadays, top surgery is really better aligned with creating a more masculine or non-binary chest. So thinking more along the lines of a mastectomy with or without nipple grafting is generally what top surgery is considered now.
Okay. And Alex, tell us, what was top surgery for you?
Yeah. So in my case, when I approached the idea of having top surgery, I was really wanting to do the chest masculization and having the breast tissue taken away as much as possible. So that's what I did. I was really hoping for a keyhole procedure, which Dr. Megan and I had talked about. Not every person is a candidate for that. So fortunately, I was able to have that opportunity. And then beyond kind of the procedure itself. So when I first started to realize that I identified as a trans man back in 2010, I really looked at YouTube videos and other trans men who were kind of posting their experiences. And I was really focused on the top surgery part of it. That's something that's really, really important to trans men like myself. A lot of us, not all trans men want to have the top surgery, but for me specifically, it was a big deal. And that was in 2012, and I had my surgery in 2019. So I was contemplating that and kind of the importance of that for a really long time. I didn't actually start testosterone as hormone replacement therapy in 2015. So I had a 3-year gap where I was really kind of struggling with my identity and kind of still trying to get used to enjoying my body and what I had. But it still was really upsetting to me, to feel like I wasn't in the appropriate form that I should be in for my gender. So then when I got the opportunity to start hormone therapy, that really helped a lot. Interestingly, it really took away a lot of the fat around that area, and it really kind of helped. Fortunately, I did not have a large amount of breast tissue. It was pretty small to begin with. So it helped a little bit, but I still, for trans men that don't have top surgery, it's still very noticeable if you were to have your shirt off or if you were to not wear like a bra or any type of support. You could still tell no matter how small you are. That was still upsetting to me, on a personal level. And then also it's just very uncomfortable for me as trans people and as trans men specifically, when you don't have, when you're pre-op with your chest, it can be also a safety issue and also a social uncomfortability as well. I lived on the east side of the state, which is primarily very conservative and not very diverse with LGBTQ people. So at the time, I was really concerned that if people were to give me a hug or rub my back, or if I were to wear t-shirts, that they could see a binder that I was wearing, or they could feel that I didn't have that specific chest that was typical of a cis male. It also was a nightmare in the summer too. We were dealing with 100-degree heat, and I didn't feel like I could safely or comfortably wear a t-shirt. So I would wear dress shirts, or I would wear long sleeves or sweatshirts, which other trans men do that as well. That's a very common thing that a lot of us felt we had to do for our own safety and social comfortability. So that was a nightmare, just constantly having that social pressure and that actual fear of your safety or the people that were around me as well. So then I came to Seattle, and I was already in higher ed. So one of my mentors had mentioned that while higher ed, you don't go in it for the money. We're not paid very much. You can have really good, I'm not rolling in the dough here, but my mentor, who was aware of my journey as well, she just mentioned, hey, did you know that working for Washington State specifically, they do have some really good health benefits, and you should look into talking to your insurance about seeing if top surgery was an option for me, which I jumped on that, right? Because I've been thinking about this for 7 years, and even more since I had started hormone testosterone replacement therapy in 2015. So that was my main goal, was to get top surgery, especially because of all the anxiety that I had been feeling for 7 years, and then more specifically for 4 years. So for me, top surgery was everything. I won't go into too much detail about the rest of my journey, but I'm perfectly content with top surgery. It has completely changed my entire life. I can walk around shirtless. I can wear t-shirts. I can, just enjoy my life. I actually don't even think about any of the stuff that I had to think about before. And it's really alleviated a lot of the gender dysphoria that I was feeling exponentially. I'm in such a better headspace, such a better life space. And I just kind of weirdly, what's great is that I'm able to just live my life as me, as Alex. I don't even think about the gender dysphoria with that. Now, for me, that's a very unique perspective. That's something that not all trans men are fortunate to feel. So I'm not saying that top surgery is a one for all. And I still do experience forms of gender dysphoria, but it has definitely alleviated a lot of it. And so when I also talk to other trans men and other non-binary friends of mine, they mentioned that top surgery is really what was most important to them, that other stuff kind of comes second to them, but top surgery was the most important thing that they could have done for their lives and their comfortability. And I would agree. So
I love hearing this. This is the magic that I've been, wanting to bring to the listeners, that lives are being changed every day. It makes me feel so happy. Dr. Megan, I bet it makes you feel so happy to be a part of his journey, and knowing that something that you helped him with helps him live his life to full, enjoyment, not even having to think about what was bothering him before. I think that's just so amazing.
Yeah, it's awesome to be a part of, for sure. And Alex is just, one of my favorite patients. So it's nice to kind of learn more than I, kind of came into all this knowing, just by listening to kind of Alex tell me about his journey and everything that he's gone through. So I've definitely learned a lot.
Alex, did you feel like, was there a lot of information online for you during the searching process?
There actually was. I think partly because what I'd mentioned before, top surgery is such a big deal to my community and to trans men like myself and non-binary. So back in 2012, when, trans visibility was still kind of being not mainstream, and then also kind of twisted in certain ways by certain groups, YouTube was a great resource. I was able to, watch other trans men as myself. They talked about the different types of top surgery. So keyhole, double incision, a few of the other ones that aren't super common. They did talk about recovery period. They talked about, what to expect, what expectations not to expect, or, what's unique to every single person. So there was actually quite a bit of information, largely from YouTube, and then also from Reddit boards. Or I also talked to some of my other friends, a lot of my trans friends. They had already started the process, or, had completed the process of top surgery. So they were really helpful in kind of helping me navigate what I should be expecting.
That's awesome. How long is the recovery?
So for me, and Dr. Megan made a point to remind me that every patient's journey is unique to their bodies. So for me, I would say about 3 months was really kind of when I started to feel initially, that I was on the recovery period. But I wouldn't say until 8, 9, even to a year is when I really started to feel 100% back to myself. Now, I had Keyhole, so that had a much quicker turnaround for recovery than a double incision does. And Dr. Megan, I'm sure, can talk more about that. But yeah, so I would say 3 months when you start feeling like you can pretty much do most of what you want to do, and then 1 year to actually feeling back to yourself.
Do you have a clinical answer to that, Dr. Megan?
Well, I think that I always tell patients that there's kind of different stages of healing. Alex has kind of talked about that he had a Keyhole procedure. So I guess just for the sake of completeness, for listeners to understand kind of the two major operations that we do. So a double mastectomy with full thickness nipple grafting is generally for patients with larger chests that we really have to remove extra skin in addition to the glandular breast tissue. So you're left with much longer scars that we try to have kind of follow the inferior and the lateral border of the pec as part of sort of masculinizing the chest. And the tissue that we're removing actually does contain the nipple and the areola. And so we have to take them off as a skin graft and then put them back on the chest. The procedure that Alex had was still a big procedure, but a little bit less, not less invasive, but, in terms of healing, much less scarring, because the procedure that Alex had was removing the glandular breast tissue through an incision that was probably about 2 to 2.5 centimeters and was around the areola. So it's, kind of the more slang term is a keyhole, but it's also a peri-areolar approach. And so, the healing periods are just very different because the procedures are very different. But, I would say, I think in terms of the different stages of healing, I always tell patients, at least a week to 2 weeks before you're going to feel like going back to work. In terms of energy levels, because I think that that's something that patients don't always think about, is how much it sort of zaps your energy. I tell them, minimum of 6 to 8 weeks. And then, we always say final outcome for anything is a year. So just kind of reminding them along the way that, it takes scars a year to fully mature and remodel. And we tend to focus on scars on the outside. But, in Alex's case, he had very minimal scars on the outside. But the surgical dissection was a whole big area. So he was also dealing with scar on the inside. And that's going to have the same process that it goes through and really the same timeline. So, I think Alex is pretty spot on with kind of clinically how long it really takes that scar tissue to mature and soften up and really just feel like normal tissue again.
Just wanted to add on to that mainly it was the internal scar tissue that I noticed was changing throughout that year process. After a year, it did feel like my tissue was back to normal. Like, now I can still kind of feel some scar tissue here and there, but it feels like my chest and my pecs and everything were able to loosen up. And I was also working out during that period. So I noticed it more because when I would do, bench presses or certain exercise movements, I could tell, my chest feels really tight here or in this specific place. But now it feels really like it did before. But it didn't get to that point until, 8, 9, 10 months after.
Mm-hmm. Sounds about right. Okay. So the next question that I have for you, what are the requirements, Dr. Megan, for a patient to have a top surgery? What are the requirements? Why are they in place? I know I've seen some comments on Twitter that it just adds an extra obstacle for them to jump over. And I know I've had to explain these type of requirements to patients before. And I just want to hear from you what they are. Are they by state? Are they different by state? Is it different by insurance company? And what are they?
Yeah, so there's a couple of different answers to that. So, generally, we will follow the WPATH standard. So the WPATH is the World Professional Association of Transgender Health. And they are kind of the organization that, in a lot of people's minds, really set the standard. They, have done a lot of research. They compile a lot of data. And so per their requirements, there's a couple of things, but in general, most people are going to need a diagnosis of gender dysphoria. And they require at least one letter of support in support of the patient. So that's generally from the patient's mental health provider who has given them the diagnosis of gender dysphoria. But they do not require hormone therapy as a prerequisite for surgery. Now, that is the standard that I follow in my practice. And in addition to that, it's good to have boxes to check. Yes, they have a letter of support, but I also think it's really important to assess patients, from situation to situation, because especially with this procedure, there's a high level of, anxiety, depression, potentially suicidal ideation, suicidal attempts, all of that kind of instability in this patient population for a number of different reasons. And so I think it's really important to assess on an individual basis, like how stable the patient is, and kind of in conjunction with that, like how much support do they have? Because I think patients really need a lot of support throughout this whole process. And so really kind of trying to get to know the patients a little bit better, I think is helpful. I tend to ask them as well, okay, so you see a therapist. Well, how long have you been seeing your therapist? Because there are some places where a patient can go, be there for one visit, and then get a letter of support. And so I'm not saying that, that invalidates their decision to have the surgery or that they're, not incapable of making that decision. But, I just think you need to be cautious of it. And other situations that I've kind of run into as well, where I feel like it kind of circles back to getting to know the patients better on an individual basis is, patients who tend to be younger, who are still living with their family, but their family is not supportive of them. And they're feeling kind of outside or external pressure to maybe instead, like they're sort of going back and forth. Do I want a mastectomy? Do I want a reduction? And I think it's really important for situations like that for the patient to be really, really solid on their decision, without any undue outside influence. Now, in terms of insurance requirements, that varies between insurance companies. It doesn't vary a ton, but I have seen insurance companies require 2 letters of support, even though the WPATH standard says 1. There are insurance companies that will require hormone therapy for at least a year for their patients. And then sometimes things differ in terms of the coverage. So I have had to fight with insurance companies in the past who will say, okay, well, we're going to cover the mastectomy part, but we're not going to cover the nipple grafting. It's not a necessary part of the procedure, is what they say. And so, from that standpoint, coverage can vary as well.
Like everything with insurance companies.
Yeah. So no surprise, but disappointing for sure.
Definitely. One question that popped up on Google, which I think you kind of touched on, is can it be reversed? Can top surgery be reversed?
It can to some extent, but it is much, much more challenging than I think generally people think. Basically, in order to reverse something like this, you're going to treat them as if they were a cancer patient, in which case what we would have to do is put in something like a tissue expander, which is basically a deflated breast implant that you can inflate over time to stretch the skin out. And then eventually you'll go back in once you get to kind of that desired volume, take the tissue expander out and put an implant in. So it's not as straightforward as some people definitely think. But, I gave this talk at the Women in Plastic Surgery retreat, and I did a lot of background research looking it up. And there's a lot of good evidence and huge studies that show that the incidence of regret is 1% or less.
Wow.
So, I think that's definitely something that can cause some medical professionals hesitancy, especially when you talk about younger and younger patients, because we are seeing younger patients. But I think that as far as we know, the evidence that we have shows that we're doing the right thing, so.
And I feel like you're doing the right thing. Alex feels like you're doing the right thing. So you're doing the right thing.
Yeah. And can I jump on that?
Absolutely.
Yeah.
Okay. Sweet. Yeah. So talking about the regret thing, I don't want to speak for everyone because everyone has their own experiences. But for me, myself, I had mentioned, first off, my life as a kid, I knew that I my gender was as like a male, and as a boy. And I felt really uncomfortable being presented as a girl, kind of just assumed that was my identity. And fortunately, my parents were very open-minded about me being a tomboy. So they allowed me to dress how I wanted. They let me have toys that were stereotypically meant for little boys, things like that. So that really kind of helped. But it still didn't help the feelings of gender dysphoria that I felt as a kid. And I remember just, to get through my day, I would pretend that, I was in situations where I could be a little boy and things like that. And I really hated when people would assume that I was a little girl. And the depressing part of that's really kind of disappointing, that I'm so grateful that, trans kids are being allowed to kind of express who they are authentically, is that as a kid, I really thought, as kids have this perspective that what they experience is not necessarily what everyone experiences, and that they are quite not sure about the longevity of what they're experiencing. So for me as a kid, I really felt that I, was the only person that was experiencing what I was experiencing. And this was back in the 90s where, trans visibility really wasn't existent, especially not for kids. And two, I felt like this was a secret and that this was something that I would have to live with till the day that I died. And I didn't feel, and this was as a kid, that I didn't really feel like there was any option available to me. I knew my gender and I knew I wasn't in the right body that was affirming that for me. And I felt completely stuck. And so then I dealt with that. And then I went into high school. And in high school was actually a very beautiful teenage presenting girl and very popular and stuff like that. But inside, I was dealing with a lot of depression, and I was dealing with, suicide ideation, extreme depression, social anxiety, and things like that. And it was largely due to the fact that my body was not aligning with my gender, and I felt extreme gender dysphoria, but I didn't feel like I could talk to anyone about it. And I didn't even know that had I been that age, that top surgery or any type of affirming procedure was even possible for me. So it wasn't until, actually I did come out as trans when I was 18, and that didn't go over very well with a second family that I had lived with. And then they had asked me, have you ever thought about being a lesbian? So I lived that way for a couple of years, and it still didn't feel correct. So as far as getting a letter of support from a therapist, which was something that my insurance company required. So they required that I have one letter of a therapist, one letter from doctor kind of, explaining that, yes, I have gender dysphoria. And I did have to be on HRT for a year. And that kind of came in separate, timelines for me. But my initial letter that I had gotten was from my therapist at my college. And I had walked into his office, and I actually sat down, and I was very matter of fact. And I said, so I came out as trans when I was 18. I was told that wasn't a thing. So I lived as a lesbian, and now I'm sitting in your office and I'm telling you that I am coming out as trans again. So it's not really a phase for me. This is how I actually feel. And he laughed and was like, okay, this is the easiest case that I have. So I was very assured of myself. There was no doubt in my mind that, what I had been feeling my whole life was actually correct. So it was great to have that affirmation from my therapist as well. And he wrote a letter, and then that was in college. And then when I left college, here in Washington State, I believe the legislative body made it so that insurance companies cannot deny care for trans individuals. Dr. Megan, is that correct?
Yeah. That was,
okay.
I think that was in 2014.
Yeah, which is great, which is fantastic. So with that, by the time I was interacting with Kaiser, which is my insurance company, I think in 2019, they were pretty straightforward about what they needed. And they also had a gender care team. So that was fantastic. As a trans person, my community, we are, often discriminated in the medical community. So our attitudes toward the medical community is one of trepidation and anxiety. So much so that a lot of trans individuals and even just people within the LGBTQ community avoid medical care and avoid preventable medical care to the detriment of their physical and mental health, not to mention also the financial barrier that has as well. So I went into that, my mentor had said, hey, you have a job in the public sector, you work for the state, which is great because you'll have great insurance. But even knowing that, I went into working with Kaiser with this feeling of anxiety of how was I going to be treated? How was I going to be able to get this process going to get top surgery? And then my PCP had mentioned that, we have a gender care team. you want to get in contact with them? And I said, yes. So they, wonderful people, they have a great team of social workers they were working with me getting all of this set up. They actually sent me a list of surgeons who were trans friendly and who were doing top surgery procedures, which Dr. Megan was one of them. And then also they helped me get my letter of support for the insurance as well. And they dealt with all of that. Kaiser was working with them and it was a straightforward process. So Kaiser actually approved the entire procedure, which was great. Kaiser did require that I was on HRT, which is hormone replacement therapy, for a year, which in my case wasn't an issue, but I know that for some trans individuals that is an issue. I do have an issue with the requirements that are put in place for top surgery in the eyes of insurance. I think largely it's to protect their own financial interests, because in my case, as a kid, I knew my gender identity. Psychologists talk about how gender identity is pretty set as a kid and that it's really not super in flux. So I don't feel that that's any different for trans kids. And then going through that whole depressive process, when I came out as trans and then that didn't go over well, and then I came out as trans again, by the time I had sat in a therapist's office, I was pretty certain that this was my identity and that having access to top surgery was the best thing for me. And actually the therapist was really just kind of there to listen to me. I was the one in the driver's seat and the therapist was the one who was just working with me on the logistics to jump through the hoops that, insurance was requiring. But he never was trying to determine whether I actually did have, gender dysphoria or that I identified as trans man. So that was interesting. And then HRT, the issue that I have with these kind of hoops is it's not very equitable for all trans people. I was very fortunate that I live in a state, Washington State, which is extremely friendly to trans care. I was on state insurance as a college student, and that wasn't denied because of the law. I was allowed to have hormone replacement therapy that is covered, and I didn't have to pay large copays for that or, doctor visits for that. So that was really fantastic. And I know that not every state is that inclusive. So when we have trans individuals living in states that are not inclusive of that, like Arkansas or any other very conservative state, 1 year of hormone replacement therapy can be extremely expensive. And sometimes trans men don't feel they need hormone replacement therapy. So it is, in my eyes, a huge barrier. Yeah. Same with therapy. Yeah. Therapy, we live in a society where mental health is starting to now kind of be taken seriously, but still the idea of having a mental health therapist is not necessarily not widely accepted, but on an insurance level, it's not something that's widely covered. So you're kind of expected to have your own pocket pay for your own mental health kind of attitude. So for a struggling trans person, which my community is 4 times likely to experience discrimination in the workplace, to, not be able to work, having limited funds like that to pay for a therapist is in some cases not even an option for some trans people. So if you can't get 1 year of hormone replacement therapy and you can't even see a therapist to get a letter, you're stuck in this loop where you won't even get a chance to even sit down with a surgeon and talk about procedures that I had mentioned before was so alleviating in this whole gender dysphoria to begin with. For me, I feel complete. In my case, now not every trans person feels this way, and I really want to stress that. But in my case, I feel complete. I'm in a loving relationship. I have had this top surgery, which has completely changed my life. And that's really all that I wanted. So the idea of having barriers put in place on a financial and kind of discriminatory way, it would be a very different conversation. In fact, I wouldn't even be able to have this conversation with you on this podcast if that were to have happened in Washington State. So I think there's a lot to process. I do want people in both the LGBTQ and we say cishet, which means cisgender heterosexual community, to approach this not with the idea of fear or regret, but more with the idea of affirmation and understanding and listening to the patient, especially with trans kids. I don't necessarily feel that kids are completely incapable of making their own decisions, especially with the trans kid. Trans kids like myself, because of the extreme emotional pain that we were going through, we were often hyper-focused on our own identities. So we did probably more soul searching and more understanding of who we are as individuals than our, cishet counterparts who probably really didn't even need to focus on what their gender meant to them. So I feel like a lot of trans kids are very intuitive with their needs and with their thoughts. And I feel we as individuals should definitely try and support that in the best way we can. And I think the best way to do that is to have other states pass legislative, laws like Washington State did, where insurances are mandated to cover trans care. Because it starts with just being able to do hormone replacement therapy for low cost. That's where it can start. And then you can build your way up to getting that therapy letter, getting in an office of a surgeon, and kind of, starting your life.
Two things that Alex brought up that I just kind of wanted to talk about. So I think it's also important to remember, Alex talked about how cost prohibitive hormone therapy can be. But, in my experience of kind of dealing with these patients over the last couple of years, I've also had a ton of patients who, for a number of different reasons, decided to not do hormone therapy. I had a patient who was a Broadway singer and they didn't want to change their voice. When the political climate was getting really heated and it was before Trump got elected, there were a lot of patients who came through my office that said, I'm really worried about my, healthcare getting taken away. I don't want to start hormones now, only to not have it covered 3 months from now. So I think it's really important that, people know it's not just the cost. It's just there's a lot of reasons why people don't necessarily even want to be on hormones. And it's all valid. And then in terms of, seeing kids, in my experience, and I understand that it's probably a biased experience because most of the younger patients that I get referred to me are from the Seattle Children's Hospital Gender Clinic. So it's multidisciplinary. I feel like they include the whole family. So, I'm definitely getting a small selection of younger patients coming to me. But I've found that my younger patients are some of the most well-adjusted adolescents that I have ever seen. Like the patient that I saw probably a month ago that just signed up for surgery, the mom was trying to explain to me, they were like, they don't have anxiety and depression. And I think that the family was able to sort of alleviate a lot of the anxiety and the depression because they were so accepting of that patient or their kid from the time that they were 4 years old and starting to show signs of, not being aligned with the gender that they were assigned at birth. So I think that there's, I think we're learning more and more about this. And I think that people will become, the hope is that people will become more accepting and think about it in the way that Alex kind of brought up as more of just from an understanding perspective. But, unfortunately, we're not totally there yet. But Alex and I are lucky to live in a very liberal state where I feel like people are very accepting. So it's a nice bubble to live in.
It's a nice bubble to hear from because down here in Texas, we're getting there. There's a lot more exposure, but it's still a red state.
Yeah.
And I've been in the office for 14 years and I feel like even in our own field of plastic surgery, not every office is friendly to the community. Not every surgeon will do the procedures that they're asking for.
Yeah. So, there's a couple of transitions that I've made in my practice, and Alex is actually going to help me with educating the hospital staff. So when I was at my previous practice, I started doing top surgeries at the hospital that I had privileges at. Well, it was a Catholic hospital and everybody was like, they're definitely not going to let you do them at the Catholic hospital. But they did. And I kind of flew under the radar and I started doing more and more there. And it was such a learning curve to even educate the staff on just basic, correct pronouns, preferred names, what to say, what not to say. And so there's definitely a learning curve for people who maybe have just never met a trans person. And, there's definitely a lot of room for education. And then when I started at my new practice, the guy that I joined, they weren't doing any top surgery. So it was really trying to educate a whole new group of staff. This is how we need to have our paperwork. This is what we need to say. This is, the language that we use about why we're doing a preoperative pregnancy test, even though the patient doesn't feel it's necessary. There's all of these things that you really have to think about the nuances because, what Alex was talking about, they're so used to, being invalidated and
discriminated against.
discriminated against, mistrusting of the medical system. So you really have to make sure that you are trying to be as consistent in your communication as possible so that they feel safe.
Absolutely. Absolutely. Alex, if there was one thing that you could tell somebody who's somewhere in their journey, maybe they're just thinking about it, or maybe they're looking for a surgeon, what are some tips that you can give them to help them along their journey that you wish you knew before or somebody had told you before?
As far as navigating, I feel like I have had a pretty privileged opportunity in that I live in a state that is very inclusive of trans care more than a lot of the other states, and that I also work in a field that has good health insurance that, in my case, had a gender care team, because I was still really unsure of just kind of how the medical system even worked. I had watched YouTube videos and I had talked to friends who gave me some referrals on who they had seen. But interestingly, if I were to get my trans friends in a room and you guys were talking to them, they would tell you that they'd seen a million different surgeons from all over the nation. So it was helpful, but also not helpful, because you can't always afford to take a plane ticket to Florida, So it was difficult to kind of navigate what that would look like for my own personal journey and what was even realistic in my scope of opportunity. So I felt very fortunate to have the gender care team in my insurance because they really helped me navigate the system, which you wouldn't necessarily think an insurance company would do that. But, they helped me get into contact with Dr. Megan. They let me know she was in network and that they would cover a lot of the procedure, but that's not always the case for other trans individuals. I have had actually a lot of trans individuals of my friends, they have had to pay it financially out of their own pocket, which is, they've mentioned that it was a $12,000 surgery, who has 12 grand, So a lot of them will save for it, will work 3 or 4 jobs to get ready for that surgery. Dr. Megan also highlighted a very important point that I also want to highlight. Make sure that you have really good care and a really great recovery team afterwards. I didn't realize how much recovery I would need for top surgery. I laid in bed for those first 2 weeks. I really didn't feel like I could get out of bed. I really needed somebody to help, cook for me, help me do my laundry, things like that. There were things I couldn't actually physically do, like vacuum or lift things more than 10 pounds. So that's something that I would suggest anyone that's thinking about the surgery is just make sure you have a really good support team. Unfortunately, in the community, it really isn't good news because not every trans person has a very loving and welcome family. Some trans individuals they're not in a partnership with someone. So I would say if a person finds themselves in that situation, then to try and lean on friends or anyone that you feel safe and comfortable and that you can trust them with your care. I did know a trans person who had to do it alone, and I really don't know how he was able to do that. I hope that's not something that anyone else needs to find themselves in. Maybe even reaching out to some of the LGBTQ communities and organizations to see if there's some form of support that's given for aftercare. I would say that's one of the most important things. Yeah, it's making sure that you can find an inclusive state that has good laws, trying to find some form of opportunity, working in a public sector or something like that, where you can get good insurance. There's a lot of variability there that I feel very lucky to have been able to work through. Yeah. I don't know if that necessarily answers your question.
It does. It does answer my question. Dr. Megan, answer this question for me. If a patient is not getting it covered through insurance, do they still have to have all the diagnosis letters and the requirements?
I think that's surgeon dependent, but a lot of times we will follow the WPATH standard.
Even if it's cash pay. So still require the letter or whatever, the hormone therapy or what requirements?
No hormone therapy with WPATH. It's really just, a letter of support.
Okay. That was one of the questions that I had just because I saw it on Twitter a few times. Do we have to get the letter if we're paying for it out of pocket? So,
yeah. And like I said, it's not, you don't have to follow WPATH standards as a surgeon if you're, not dealing with insurance companies. But I think that, we also have to think about like medical legal stuff. And I think that if that's the standard that sort of bends that forth, then, we feel like we kind of need to adhere to that standard. So
Yeah, I completely, I hear you.
With it.
I hear you. So this episode, I feel, has been really great. Alex, thank you so much for sharing everything that you have shared with us. What I want this episode to be is just a glimpse of what your journey was, what your journey is, the hoops that you had to go through, the excitement that you have in your life now that you've gone through the surgery and you can live finally as how you want to live. And Dr. Megan, thank you so much for bringing Alex on and sharing this story with us and educating us really on what the requirements are and why they're in place.
Yeah, absolutely. Thanks for.
Thank you so much for having me. I'm really glad I was able to share.
Alex, lastly, I always like to ask our guests for a piece of advice if it was your best friend. One piece of advice for whatever, from your whole journey, from identifying, from coming out, from finding your surgeon, from recovery. What's one piece of advice that you would want to give your best friend?
I would say meet yourself where you're at. This is a process that can be extremely overwhelming. There's a lot of variability and a lot of things that have to come into play as far as insurances, finding a provider, finding support, meeting all the requirements, whether they're necessary or not, which can be very stressful on yourself. I would say just meet yourself where you're at, assess where you are, where you want to go, and take baby steps. I feel like a lot of us, we feel we have to get this all done immediately. I definitely felt that way as well. But just take one step at a time, do what you can. I never really thought that top surgery was even going to be an option for me. I was just thinking hormone replacement therapy was what I could get financially and within my scope. But I was able to do just one foot at a time, get connected with people that were able to help me. And then I was able to have top surgery that was completely covered for me. So it is possible to just work your way through the system, make sure you have a good support, and be kind on yourself.
I love it. That's perfect. I think that's the best way to end this episode. Thank you both so much for joining us, and I can't wait for us to speak again.
Awesome. Thank you so much.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.